cancer 2026 update. Okay, today I'll be reviewing an article from no other than the American Dental Association, okay, which is fairly very reputable source when it comes to most updates in relation to oral health and dentistry. Okay, so they have very interesting oral cancer guideline 2026 update. This is a video and actually live streams being recorded in 2026, April 14th of April. Fun fact: April is also Oral Cancer Awareness Month and my birthday month. So do that information what you wish. I'm gonna keep this very objective, review the actual information from there. Then at the end, I'll say some remarks, some final notes in relation to this. Okay, so since it's my birthday month, also like on this video and write a comment below. I think there's a misconception with a lot of people that oral cancer, they think about smoking only, but that's not really the only cause or the only reason for oral cancer to arise. Many other things that are involved. Anyways, let's dive deep into this 2026 update in relation to oral cancer from the ADA. Okay, so I'll be linking also the ADA website and the ADA article for those who would like to read and gather more information in relation to this. Please do your own research. This is just for educational purposes. Okay, so I wrote some notes. That's why I'd be looking here and talking as well. Okay, so early detection of oral cancer is very critical to improve the survival rate and the treatment success. Actually, very true. Unfortunately, with regard to cancer, it's very, very important to detect it as early as possible. Sometimes it can be challenging to detect cancer as early as possible. You need a trained eye, and also someone with experience in diagnosis and detection of oral cancers. In dental school, we did get education in relation to oral cancer, how to detect it, how to suspect there's an oral cancer arising or potentially malignant lesion or cancerous lesion is happening. Okay, the American Dental Association recently updated their guidelines to ensure both dentists and patients have the most accurate information to date, and this is why I do it. I'm an evidence-based dentist. That's why I do this video. Okay, right. So let's start with some key takeaways from this. What about regular screenings? Regular screenings is very essential in relation to the early detection of oral cancer and in routine checkups. A lot of people, maybe the general audience, I don't want to say everyone, but let's say some people, okay? Okay, so some people, they think of a dentist checkup. What are the ideas that come to your mind? I'm talking from patient's perspective or from a regular person's perspective, not a dentist's perspective. They're going to think about maybe dental plaque, dental tartar, maybe there are some cavities, maybe some tooth pain, wisdom teeth, but I don't think a lot of people are thinking much or suspecting oral cancer. Unfortunately, this is the case. Some people have oral cancer, so that's why it's important during visits. That's what I'm going to get into. So routine check during every visit, the dentist should perform visual and tactile exam, mean looking at and feeling tissues inside the mouth, as well as checking the neck and jaw area. Okay, medical history matters. It is important to provide medical history is very, very critical. The detailed medical history of the patient, we can see some things that can be important in relation to oral cancer as well. Okay, so it's important to provide an updated history of your health, including critical things such as smoking. I talked about smoking earlier, or alcohol use. Any family history of cancer. These factors are important for the risk level. Okay, what about diagnosis? Which is very important part here. So if your dentist finds this spot or lesion looks suspicious, they must determine exactly what it is. Okay, so it shouldn't be just, oh, okay, there's a spot and whatever. No, they should be really examining that area. Is it potentially, does it make them suspect this for it to be something more than just a tiny spot. Okay, so they talk about biopsy, which is very important. I'm going to give you the exact wording from the ADA article about the biopsy, because I saw this was very important. So they say, or at least was written in the article, biopsy remains the reference standard for diagnosing OPMDS and OSCC. I'll tell you what these are in a second. Okay, so OPMD as in oral potentially malignant disorders, and OSCC is oral squamous cell carcinoma. Okay, so biopsy remains very, very critical. Okay. So if suspicion is found, the guideline recommends performing like biopsy immediately, or referring to a specialist who's more knowledgeable in the area without any delay. As we said, timing is very important. To be early in the detection of oral cancer is very, very important, critical for the management of the oral cancer too. Okay, so we will get to more things in relation to this. Actually, very interesting article. I really enjoyed reading it. And I thought it's a great way for people to learn more about oral cancer. Of course, everyone, please do your own research. Okay. Okay. Right. Let's continue. So what other things? So you need to understand also newer testing tools. They consider them as or written as adjuncts. Let's have a look at adjuncts. Okay, I'm going to explore the use of 4 different adjuncts in early oral cancer detection. The first 2 parts of the multi-part series exploring cancer detection methods are cytology and vital staining adjuncts. Okay, so what do we have? So I'm just going to give you a little bit of some important details about these. So adjuncts are as in extra tools to help the dentist side make decisions in relation to oral cancer. Okay, so we have something called as cytology. So as in scraping cells from suspicious area to look at them under a microscope. Can be a helpful step in deciding if full biopsy is necessary. We have vital staining, as in dyes. Welcome everyone who's joining. We're talking about oral cancer 2026 update from the American Dental Association, the ADA. You can write your comments below if you have any questions. I'm going to go through the article because I need to post this video to increase awareness in relation to oral cancer. Okay, so vital staining as well, the dyes, medical dyes, of course. And it's very important to note that they're not really they are not a replacement. So these tests are helpful triage tools, but they did not really replace the need for biopsy if the dentist is concerned with the lesion. Excuse me. Okay. Right. Let's look at what other things are mentioned. Okay, so they do also. I saw a note that parts 3 and 4 of the series will examine light-based adjuncts and salivary tests, respectively, to be published throughout 2026. And if I came across the updated articles, I will also be definitely talking about them. Okay. So there's cytology, vital staining. Okay, so adjuncts to determine the need for biopsy after a clinical oral exam. I'll just repeat them. There's cytology, there's vital staining, there's light-based. I'm going to go over the cytology. Cytology, a close look at the cells to evaluate whether they appear to be normal or show abnormal signs. Okay, it's very important in relation to oral cancer. Vital staining. Vital staining, a special staining liquid that highlights areas in the mouth that appear to show abnormal signs. It's in relation to vital staining. Then we also have light-based, which is a special light to detect changes in oral cavity and lips that might not be visible to the naked eye. Okay? Right. counseling and follow-up. They have, of course, some more added notes, things in relation to clinical oral examination. They say, so guardrails to guide the initial oral assessment before considering adjunct, okay? So comprehensive oral health screening that informs the next steps for timely diagnosis and care, okay? You talk about good practice statements. They are written there. There are also full guidelines for people who want to look at this. Welcome, everyone is joining. Please like, double tap on this screen. It really helps support the channel. Share this with your friends. We're raising awareness about oral cancer. This is 2026 update. If you're new to the channel, my name is Dr. Mo and I'm a dentist. Hello, Doc. Welcome, my friend. Welcome, everyone. Please like, double tap on the screen. So you don't eat sweets, someone is saying. Right, now there's definitely more information there, just to be clear. So I'm trying to look at just critical things or important things to note. Okay, what should watch for? Teen dental visits. Yeah, it's important to pay attention to things such as sores that do not heal within like 2 weeks, lumps or thickening of the skin or the lining of the mouth, red or white patches on the gums, tongues or cheeks, persistent pain or numbness in the mouth or lips. There are just some important things to note. Okay, so in the article there are also, okay, great. I just found a very important part. Your thought, okay, anyways. Right. Early detection of oral squamous cell carcinoma and oral potentially malignant disorders. So there's a note in relation to population, I guess. So written on the ADA article, these recommendations apply to the following: adults aged 18 and older with or without mucosal abnormalities, with or without symptoms, location, oral cavity and lips, setting, primary care. So, and they show a picture of homogeneous leukoplakia as an illustration, and non-homogeneous leukoplakia. So symptoms to look out for and be aware of in the same population section: unexplained pain, abnormal bleeding, patch, ulcer or growth, tooth mobility, numbness, neck lymphadenopathy, change in speech, dysphagia, okay, dysphagia, odinophagia, globus sensation, unexplained weight loss. Okay, very important notes. They have a note on the clinical pathway. I'm just going over the ADA article. There are also recommendations, with some of them we talked about, the guardrails to guide the initial oral assessment for considering adjuncts. Adjuncts to determine the need for biopsy after clinical oral examination, which we talked about, like in relation to cytology, vital staining, light-based. There are also practical implications. Okay, so what are practical implications in relation to this? I'm just reading out directly from the. I don't know. Okay, so I'm talking about oral cancer. There are 20. There's a 2026 update on the ADA website in relation to oral cancer. It's very clear. This is what I'm reading. Someone's asking. Okay. Anyway, so what are patient counseling and follow-up? So a positive or typical Okay, so this is actually very, very important. The practical implications, I think a very important section in the article. Patient counseling and follow-up. So a positive or atypical cytology test results reinforce the need for biopsy or referral. Okay, welcome everyone. A negative cytology test result indicates the need for interval follow-up of the patient if the target mucosal abnormalities persists. Persistence or progression of a mucosal abnormality varies depending on baseline clinical features and individual patient and environmental factors. If a clinician implements watchful waiting, a biopsy, or referral should be indicated when abnormalities persist beyond 10 to 14 days without a definitive diagnosis and treatment plan. Okay, these are under the patient counseling and follow-up. We have also a part for patient values and preferences. Clinicians recognize biopsy as the gold standard. Very important. Clinicians recognize biopsy as the gold standard and acknowledge responsibility for referring suspected cases. However, some patients prefer less invasive adjunctive tests, creating potential tension between the recommended practices and patient preferences. Okay? Another note. Okay, standardized communication protocols are needed for disclosing oral potentially malignant disorders, as clinicians typically attempt to balance diagnosis disclosure with minimizing patient distress and anguish. Okay? No evidence is available regarding patient and clinician values and preferences toward advanced diagnostic technologies, including artificial intelligence. Okay? Why is this AI note or artificial intelligence note very important here in this article? Because I talked about things in relation to diagnosis of oral cancer, some methods that are used, and adjunct methods as well. However, that being said, there are also AI is and will be more involved, in my opinion, with the diagnosis of oral cancers. And as AI, artificial intelligence, progresses even further and becomes smarter, I think this is a net positive for, in my opinion, both the patient and the clinicians, dentists and oral surgeons. As AI progresses further, I think it will help more in the diagnosis and perhaps maybe at some point also in management of oral cancer. Okay? Again, April, month for oral cancer awareness. Thank you everyone for watching for the video section. Right now, if some people have questions or want to say something in the comments or messages, they can write